Hi, everybody. Thank you so much for inviting me to talk about this topic, which I care very deeply about. And before I started my talk, especially after hearing Steve's talk, I just wanted to make a quick comment about how we talk about autism, and just say that as a pediatrician and a researcher, I think within the broader autism community, we're still at a crossroads of what we even call autism and people on the autism spectrum. And so I think that you'll hear from me and also from some of the speakers that come up that we refer to autism in many different ways, including autism spectrum disorder, and also that there's quite a variation in terms of using condition first and person first language. And I want to say that we don't mean this in any way as disrespect towards people on the autism spectrum or their families and supporters, and that I think as a scientific community, we're really at a crossroads of how to talk about it. And in my own slides, I've tried to say autism or people on the autism spectrum often, but the truth is that a lot of the research that we refer to used survey items and was based on definitions from DSM-5 for autism spectrum disorder. And so I think you'll continue to hear this spoke about in various ways throughout all the talks today. And I guess the other thing I'd say is when people say autism spectrum disorder, we in no way are trying to imply that people on the autism spectrum need anything reordered, that we are just going by the DSM definition. So the objectives of my talk today are to describe racial and ethnic disparities in early identification and treatment of autism disorder, and then to discuss a little bit more about why these disparities exist in terms of community, provider, and healthcare system factors. And then I'm going to briefly talk about some of my research and some research of others that's aimed at reducing these disparities and hopefully improving healthcare quality for individuals on the autism spectrum. I just wanted to really briefly talk about this because I know there's some people who are more from the ethics community who perhaps know less about autism here today, and just remind people of the diagnostic criteria for people on the autism spectrum. Basically, there's two primary factors that go into an autism diagnosis. The first is atypical social communication interaction, and the second is restricted and repetitive behaviors and interests. And to have autism or autism spectrum disorder, you have to have characteristics from both of these areas. Other key features of autism is that it develops in early childhood and must cause significant impairment in a person's daily life. For the most part, we know that autism is a lifelong condition, and however, the first signs appear very early in life. Usually, most parents will report signs appearing in the first year of life, and the condition can be reliably diagnosed by trained experts by about age 2. We know that the best way to improve outcomes for children with autism is to offer them treatment early. And in fact, the strongest evidence base for treatment for autism in early childhood is for rather intensive therapy, and some experts think that children can benefit from at least 20 hours of therapy per week in some cases. And so this is a therapy that can take a lot of time from both families and also from the healthcare and educational systems. Therapy for autism can be provided by parents or therapists, and really that is the core of autism treatment is therapy. There's no medications for the core autism symptoms, although medications can sometimes be used to treat autism comorbidities. We know that early intensive treatment for autism has been associated with improved long-term development outcomes in children, including higher IQ, also improved functioning, and language outcomes as well. Also, early treatment has also been associated with improved family coping with the condition. And the other thing I'd say is that given that the lifetime costs of autism spectrum disorder are estimated to be about $2 to $3 million per individual, which actually is higher than heart disease or cancer, there's probably a substantial financial benefit for early access to treatment for children. Unfortunately, however, we know that early access to diagnosis and treatment is not equitable in the United States. This is data that just recently came out from the CDC's Autism and Developmental Disabilities Monitoring Network, which provides multi-state surveillance for autism. And as you can see here, there's this is just the prevalence per 10,000, and this is 2012 data among 8-year-olds. And you can see that there's a difference between males and females, which is thought to be kind of intrinsically related to autism spectrum disorder. But we also see here, if you look kind of on this right side, that there's a significant racial ethnic difference in autism. And this difference is not thought generally to be due to biological factors. And particularly when you look at the breakdown of where these groups are different, you can see that the main area of difference is in this tan bar here, which is in the children who have IQ greater than 70 or borderline to average IQs. So another way of putting this is that if you are a Black, non-Hispanic, or Hispanic child and you are functioning in sort of a borderline to average way, your chances of being diagnosed with autism and accessing therapy that might really help you are quite low. Racial and ethnic minority children are also more likely to be misdiagnosed. This was data, actually it's now from almost 10 years ago. Hopefully the study will be repeated, but it was from a large sample of children on Medicaid in Pennsylvania, and all of these children eventually were diagnosed with autism. But then they went back and looked at what diagnoses they received before they received an autism diagnosis. As you can see, if you're African American, which is shown in the dark bar, or other race, which is shown in the white bar, you're much more likely to be diagnosed with certain other diagnoses before you got diagnosed with autism, which was in fact your true diagnosis. So conduct disorders, adjustment disorders were more likely to be sort of incorrectly given to children who eventually were diagnosed as on the autism spectrum. And then the third factor, which is important, is that when minority race ethnicity children are diagnosed with autism spectrum disorder, they're more likely to be diagnosed at an older age. And so this is once again data from the CDC, looking at surveillance data of kids who are currently 8, and look back at how many of them had a first comprehensive evaluation for autism by the age of 36 months, which should be when autism is apparent in the majority of children. And once again, you can see that if you were non-Hispanic Black or Hispanic, you were much less likely to have a comprehensive evaluation by age 36 months. And then to complicate matters further, once you get a diagnosis, your access to autism therapy is much less if you are a minority child. So this was a study that recently came out looking at public spending on education for children on the autism spectrum. In California from 2012 to 2013, and this is just the public dollars spent per year on a child with autism, and you can see that both African American non-Hispanics and Hispanics were much less likely than white non-Hispanics, or received much less money in actual treatment dollars. And the LA Times actually did a really nice series on this a couple years ago where they highlighted a couple families who were affected by this, and this was one of the children profiled in the series. It says, Giselle Garcia, 11, was diagnosed with autism when she was 3, early enough that intensive therapies might have helped her, but her parents say that neither LA Unified nor state officials ever mentioned the possibility, and now the sounds that she makes are unintelligible. So there's a lot of children out there, particularly minority children, who could really benefit from early access to therapy, but who unfortunately aren't getting this kind of access. So I think there have been quite a number of studies now demonstrating these disparities in autism. I just sort of showed you a select few, and I think we've come to the place as a research community where we know these disparities exist. And one of the things that I've really tried to do in my own research is try to move on to the next step of not only do we have these disparities, but kind of think about why they exist, what factors contribute to them, because I really think that that is the key in terms of developing interventions that would be successful at reducing autism disparities. And so I'd like to propose to you that probably the reason for poor access to autism diagnosis and treatment in kids has to do with a number of factors, which I've sort of divided up into characteristics about the condition itself, provider and healthcare system factors, and then also family and community factors. And I thought maybe we could get into each of these in a little bit greater detail and think about how and why they contribute. So the first is characteristics of the condition itself. For one, we know that autism is not a condition that's apparent at birth, especially if you compare it to other developmental disabilities of early childhood. There's no parent who comes home from the newborn nursery with their newborn baby in their arms, and the doctor says, "You've got an infant with autism." It doesn't happen like that. There's no, it's not apparent at birth, and there's no simple test for it either, so we can't do a blood test and tell a family that their child has autism. Instead, what actually happens is that the onset of symptoms is subtle. It happens slowly over childhood that a parent eventually realizes that their child's development is not similar to their peers. And it may be mistaken for a variation of typical development. And in fact, as Steve mentioned earlier, there's probably quite a large continuum between people who are severely affected in a way that really interferes with their functioning, and also people with autistic features whose development might be considered typical, and where we sort of make the cutoff point between typical and autism spectrum disorder is challenging both for parents and for the healthcare and educational communities. Likewise, severity is quite variable, so it may seem at sometimes that a child's functioning is significantly impaired, and then at other times it may not seem that way, so it can be confusing for parents, and the child's symptoms can change over time. So autism isn't unique in this way, but it's one of these conditions where early detection is just particularly challenging for families, educators, and healthcare providers. So that is disease characteristics. Now I'm going to move on to provider and healthcare system factors that affect early identification of autism. And I think I made this slide once just to show you what it's like to get an autism diagnosis and treatment here in Oregon. And basically to show, and I don't think Oregon is uniquely bad. And I know the system in autism in Washington is somewhat similar. But it's not a diagnosis that you can just go to your pediatrician and your pediatrician takes a look at you and says, it must be autism. In fact, the diagnosis is really rather difficult to get. And so if you have a typical family shown over here, if they have a concern about their child's development, they would probably go to their primary care provider, who would then have to refer them to a specialist team at an academic medical center, probably, or another large medical center. Often, as Steve mentioned, people go and see multiple specialists before they can get a diagnosis, because they often get sent to the wrong place initially. And then, only then can a child get a medical diagnosis after basically at least one full day of testing. And you'd think, well, that's great, you've got your diagnosis, now you can get treatment, but in fact, that's not the case at all, because especially in early childhood, a lot of the therapy for autism occurs through the school system, which basically has a completely parallel process in which the school system itself has to do an evaluation by its autism specialty team, get what's called an educational label, and then you can get therapy from your school. If you also want to get therapy through your healthcare provider, then you need to go get this other medical diagnosis as well. So it's basically like extremely complex, involves multiple steps, involves multiple parent and provider and educator input at every step. And I think when you have a process like this that is so complex and so challenging, it's really not a surprise that the families who have the least resources and the least health literacy and the least capacity to spend time and family resources on this don't often get through it. And certainly it leads to delays in the age of autism diagnosis, since there are so many steps. Now I just want to move on and talk a little bit about healthcare provider factors and how healthcare providers are contributing to delays of diagnosis. And as a primary care provider myself, I'm very interested and keenly aware of the role that we play. Especially for minority kids, primary care may be the only education or health professional that a family interacts with in early childhood on a regular basis, and so we're really important in early autism identification. And in fact, the American Academy of Pediatrics has recognized this, and this is why they recommend both standardized broadband developmental screening for all kinds of developmental conditions at well-child visits, and also specific screening for autism spectrum disorder at 18 and 24 to 30-month visits. So all pediatricians should be having families complete a brief checklist to see if their child's at risk for autism spectrum disorder. And then if children are identified as at risk, they should be referred to appropriate services. And I don't know if you guys have ever seen an autism screening instrument, but basically about 95% of pediatricians use this one, the MCHAT, which is a 20-question yes or no screen that has basically developmental milestones that may or may not be related to autism. And it's a pretty simple, publicly available 20-item checklist that families can fill out. And it's available online for free in English and Spanish and about 15 other languages. So one of the things I was interested in my research is, okay, we know we have this free, publicly available instrument to screen for autism. Are pediatricians actually doing this? And in particular, are they doing this for children who are a minority? Because those would be the children who are at the highest risk for delays in autism diagnosis. So we were particularly going to look at the Latino population, which is our largest minority population here on the West Coast. And we did a survey of 500 pediatricians in California in 2013. And what our research questions were pediatricians offering screenings that meet the guidelines for screening, and then are they equally offering these screenings in English and Spanish for families who speak Spanish as their primary language? And then aside from are they screening, how do pediatricians feel about this process? Like, do they feel that they're capable of identifying children at risk from children from different ethnic backgrounds? And so these are the results of that study. As you can see, not a lot of pediatricians were doing any kind of screening, less than 50% overall. Only about 30% were doing general developmental screening, and fewer were doing it in Spanish than English. A little bit more were doing autism screening, probably because it's free, but there were still big differences in terms of English and Spanish. And if you look at the number of pediatricians who were doing both screenings, it was really quite low, only about 15% for general developmental screening, and only about 10% in Spanish for both kinds of screening. So if you were a Spanish-speaking child and you came to a pediatrician in California, you'd probably only have about a 1 in 10 chance that your pediatrician would assess your autism risk. And we thought, well, okay, maybe Latino kids cluster in practices where the practice might be more capable. And so we looked at specifically at the practices that had at least 25% Latino patients. And you can still see that it's not like things are dramatically better for the pediatricians who see all the Latino kids. It's still only about 15% and 10% performing these really critical screenings. Then we just asked the pediatricians, well, regardless of the screening, how do you feel about identifying the signs and symptoms of autism in each group? And we compared, we asked them to compare non-Latino whites, Latinos who speak English, Latinos who speak Spanish, and African-American children. And as you can see here, regardless of whether they were screening or not, pediatricians felt almost twice as uncomfortable. So 60% saying it was somewhat or very difficult to identify the early signs of autism in Latinos who are Spanish-speaking compared to non-Latino whites. And this is a significant difference. And actually, we looked across different subgroups of pediatricians too, like pediatricians who said they were very knowledgeable about autism, pediatricians who were actually following all the screening guidelines. And even in those groups, there was a significant ethnic disparity in which all pediatricians pretty much felt that identifying these conditions in Latinos who speak Spanish was very challenging. There you go. And then we asked them, what are the barriers then if it's so challenging? And some of them were healthcare system factors, as indicated here with the red arrows. They pointed to limited access to primary care, so maybe the kids aren't coming in the first place. Definitely having limited access to autism or developmental specialists, which is a big challenge in this country. There's only about 1,000 developmental pediatricians in the whole United States. And then the other thing is that language and cultural barriers were also really important, both between patients and providers, and families. So to sum this research up, we found that pediatricians are screening for autism at very low rates, particularly in Spanish, that developmental specialists were difficult to access, and that this was contributing to delayed diagnosis, and that language and cultural issues between families and providers may be playing an important role. So the last factor I wanted to talk about was family and community factors in early identification. of autism. And I think as a healthcare provider, I'm aware of how important parents are in observing their child's development and fostering healthy development in children. Parents are the most important early observers of their children's development. We know that about 80% of parent developmental concerns are well-founded. What parents consider sort of normal versus abnormal, who they discuss their concerns with, probably has a large role in early identification and access to care. We also know that families vary in their abilities to navigate the healthcare and educational systems. So we've done a lot of work talking with parents and families about autism, with particularly focusing on the Latino community here in Oregon, which is our main minority community. And it's really challenging because what you want to do is find out what are parents thinking sort of before their child was diagnosed with autism, but that's a very difficult population of parents to interview because they don't know that their kid's going to have autism yet. And so what we've done instead is talk both with parents of kids who've previously been diagnosed with autism and have them look back and say, what were the factors that made this difficult for you? And the other thing we've done is we've talked a lot with parents of typically developing children with the idea that every parent of a child on the autism spectrum previously was a parent of a who thought they had a typically developing child. And so what does sort of the average parent on the street think about autism? And because these people may better represent sort of the community views and awareness of resources in general. So we've done focus groups, and we also did a large 3-state survey of parents, and I'm going to tell you about those results. So the survey of parents of children who are already affected with autism we did in Portland, Denver, and Los Angeles. And we intentionally surveyed 3 groups, parents who identified as Latino who had limited English proficiency, so we're primarily Spanish-speaking, parents who were Latino who spoke primarily English, and also non-Latino white families. And we looked at a whole bunch of different barriers to autism diagnosis. Sorry, this slide's a little bit small, but I ranked them all here in terms of which barriers were most important to parents overall. And so when we asked parents to reflect back on what was the most difficult about getting an autism diagnosis for their child, the most common was stress of the diagnosis process, which is no surprise given that I just showed you what the process was. And then the second most common was parents not knowing very much about autism, and the third was not understanding the medical system. The red stars here show the barriers that were different between Latinos with limited English proficiency in terms of, compared to white, which is shown the Latino with limited English proficiency is sort of this green band, and the non-Latino white is the blue band. So Latinos with limited English proficiency were much less likely, or much more likely to say that knowing about autism was a challenge, and more likely to say that understanding the medical system was a challenge. And then this barrier down here, parent trust in providers, which was not a very common barrier overall, showed big ethnic disparities in terms of being much more common for Latinos with limited English proficiency. The cost of the evaluation was more problematic for white non-Latinos than for Latinos with limited English proficiency, interestingly, probably because more of Latinos are publicly insured. I just wanted to talk a little bit more about this and give you some quotes from focus groups of families who we interacted with and what they said. Not knowing about autism, this parent said, "I didn't know anything the day that they told me that my child had autism. I didn't know what it was." And often parents sort of attributed this to cultural differences between their home country and the United States. So this parent said, well, sometimes Latino people do not understand because in reality, in Mexico, we don't have a diagnosis of autism and no one knows about it. And it's like here you come to understand so many things that over there we didn't know what they had or didn't know the name of it. And then understanding the medical system. This parent said, it took like 4 months to understand autism and find help. I had to look in the mirror and say, what am I doing? What am I going to do? Where? And then parent trusting the provider, which I mentioned showed one of the biggest disparities. It was really interesting. I don't have a quote for this, but several parents in our focus group said to us, we really wondered if the doctors were actually trying to diagnose our child with autism or whether they were just kind of wanting to do medical research on the child. And so there was a real sense that trust in the system, which may not have been high to start out with, sort of eroded throughout the autism diagnostic process. I'm going to move on now and tell you about a survey we did last summer, which we haven't published yet, so breaking news, of parents of typically developing children. And I really wanted to find a sample of low-income but ethnically diverse children to find out what do they know about the early signs of autism, and how familiar are they, and also how is this condition perceived in their community. And so we partnered with Oregon WIC, which, if some of you don't know, is a food program for low-income children under age 5, and did a survey in WIC clinics across the state. We surveyed, I think, like 8 or 9 different counties in Oregon's WIC clinics. And we asked the parents what they knew about the early signs of autism, and then also did they know anybody who had this condition, and we looked at a few other conditions as well. The way we asked the parents about whether they knew the early signs of autism was we made this little vignette of a toddler, and the toddler and was supposed to be their friend, and they were supposed to give advice to the friend about whether the child's development was normal or abnormal. We included things that were early signs of autism, and then we also included things that had nothing to do with autism, like the child doesn't walk. And then we also included some things that were normal for age, like the child doesn't know his ABCs at age 2. And so then we asked them if they should be concerned or not concerned about the child. And this just shows you how parents performed on this little vignette according to race, ethnicity. And you can see, again, that the white non-Latinos seem to have the highest knowledge of the early signs of autism, and we're most likely to correctly identify them. And that the Latinos with limited English proficiency, once again, performed the worst, with getting only about 62% correct. And then we also asked them, do you know anybody who has these conditions? And we asked for a number of questions, just for comparison's sake. So we asked about autism, we asked about ADHD, which also is known to have significant racial ethnic disparities in access to care. And then we asked about Down syndrome, which is actually relatively prevalent in the Latino community. And you can see that both for autism and for ADHD, people were much less likely to Latino limited English proficiency is this green bar here, and autism is the red bar here, sorry, Latinos with English proficient is the red bar here, and then white non-Latinos, this is blue bar here. And you can see both for autism and ADHD that actually people didn't know anybody with these conditions, and I think this might be one of the big factors that contributes to parents not recognizing it in their own child. And so I think to sort of sum things up for family and community, there's a real knowledge deficit in minority communities about autism, its early signs, even knowing what the condition is, and sort of also a real challenge in terms of navigating the healthcare system, so that even if you are concerned getting your child to the therapy services he or she needs. The last part of this talk, I just wanted to talk about possible solutions and things that I and others are doing to try to remediate disparities in early identification of autism. And I agree with some of the previous speakers that Autism Speaks as an organization has some funding challenges, as probably does the federal government. But I do think the good thing about being someone who does research in early identification is that this is a bus we can all get on, and that I think most people will agree that regardless of how you feel about autism, you probably feel that children with the condition should be identified early. And so we got this research grant 3 years ago from Autism Speaks to specifically do outreach to pediatricians in community clinics who are caring for a large number of Latinos, to try to at least improve the performance of us as healthcare providers in correctly identifying these kids. And so we've been training primary care providers in 6 safety net clinics. To qualify, the clinic has to have at least 30% Latino patients. And we're teaching these clinics to screen for autism and other developmental disabilities, to interpret their screens correctly, because one of the problems we found is that pediatricians will often have a positive screen, but then sort of explain away the positive result by saying, oh, it's because the family's bilingual, or oh, it's because it's a single mom and she hasn't enough time to talk to the kid, and really encourage them to act on positive screens. And then to refer children for services in a culturally appropriate way that will be motivating to families and will encourage them to go without scaring them off. And we're looking to see if this intervention results in increased rates of autism screening, and then hopefully also does it even within their practice look at decreased disparities in screening and referral. And so that's exciting. We just enrolled our 6th clinic and trained them last week. And so we're still collecting data on this, but I just wanted to show you first some of the resources we provide families. So sort of to address the whole, sorry it's small, but some of the resources issue, we've made these little pocket cards for parents of kids who screen positive, basically spelling out in really simple language in English and in Spanish with local resources, what do you do next? And it's really straightforward. It says, you know, schedule an evaluation by an autism specialty team, request an evaluation at early intervention or through your school district, and then find out more about autism. The providers can circle on the card where exactly they want to refer the kid. It gives them their county early intervention number. It gives some autism resources for families to look at. And I think that's been really helpful for families. We've also developed some really neat non-print materials for families, like video materials that providers could use with families as well. I just wanted to show you some of the preliminary results from the first clinic who's almost completed our intervention, and this is showing here, this was a clinic that wasn't screening at all for autism or any kind of developmental disability at baseline, and in basically about 6 months, we've gotten them up to screening nearly 100% of their 18 and 24-month visits for autism and developmental disabilities. And then this also shows how many kids they referred to, kids who failed screening were referred to early intervention. And as you can see, first of all, they were hardly making any referrals at baseline to early intervention. And as time went by, they started making a lot more referrals, and they also started referring a lot more of the children who failed screens. So I think it takes a lot of one-on-one with pediatricians and talking about it and talking about it again, and really emphasizing why this is important. But I think what's exciting about this research has shown that we really can move the needle and get practices to perform better for their kids. There's some other really interesting efforts that are going around the country that I just wanted to highlight. Another interesting approach to this is sort of taking a more family-centered approach and doing family navigation for children on the autism spectrum. This is a technique that basically started with cancer screening in adults. And the idea is that when you identify somebody with a risk for a condition, you have a culturally congruent, usually a lay person, come meet with the family, usually in person, multiple times, help them understand why getting the diagnosis and treatment is really important, and then actually attending some of the diagnostic and therapeutic visits with them until they're well established in therapy. There's a large trial of this going on with Emily Feinberg at Boston Medical Center that uses an extremely diverse patient base. It's super exciting. And then my colleague Sandy Magana at University of Illinois Chicago is doing a similar thing with children who've already been diagnosed with autism but aren't accessing services, basically doing an intensive intervention with families to connect them with services. Another interesting effort that's going on here in Oregon with my colleague Bob Nickel is that if you remember the slide I had before that showed sort of the complexity of the medical and educational process for diagnosing autism, what they're trying to do is really change the process itself. And instead of having to go to like 16 different places to get autism diagnosis and get treatment, what they've done is bring the autism medical and educational diagnosis to the child's community, to their primary care office with sort of, we call them like remote autism teams that will come get stakeholders from both the educational world and also the medical world to come make a diagnosis together at the same time, and then immediately link the child with the most appropriate medical therapy resources. And this is really key, especially in Oregon, because we've got such a large rural patient base. And sometimes just driving the 6 hours to get to Portland to get an autism diagnosis can be a real barrier. I just wanted to end by talking a little bit about you people here and what you can do just as community members, as healthcare providers, as educators and supporters of people on the autism spectrum to help promote early diagnosis in kids who are at most risk. And just say, you know, I think it's really important that we keep on talking to healthcare and educational providers about autism screening and early identification, and that telling people the message that that just using your clinical judgment will be adequate for kids who are having severe compromise in their functioning, but to catch those kids who are sort of struggling to make do in the mainstream setting but are not quite making it, we really need to screen. It's the most effective way to identify these kids early, and it's the most fair, and that we can't just rely on our clinical intuition to identify this condition. I think it's really important that families of kids who are on the spectrum talk with other families and talk with their healthcare providers and their educators about autism often. I know it seems like it's in the mainstream media a lot, but I think it really only is in like Steve said, in certain ways about like what causes autism, not what to do after you've already been diagnosed, and not about what the early signs might be. And that if we can talk about it in a positive but kind of motivating way, then that's really the best. And then to the healthcare providers and educators out here, I tell you, if a parent expresses their developmental concerns to you, take it seriously. Don't discard those concerns easily. We know that parent concerns are really accurate predictors of a child's developmental risk, and that it may have taken a parent a lot to even bring those concerns up with you. And so don't cast those aside. Don't assume that parents know anything about autism. I always tell the medical students, it's kind of like the kidney. Parents really don't know what that thing is or what it does, and you have to really explain it. And then I think as policymakers and just citizens of our society, we really need to improve the system. The system that I showed you for accessing autism care is really no system. It's just a big mess. And that we need to come up with a better way to effectively and early identify these kids. And you know, I really hope that we can move forward in having this access to this diagnosis be early and prompt for all children, not just high socioeconomic status white kids. So to sum things up, delayed access to diagnosis and lack of high quality treatments, a major problem for especially minority kids with autism spectrum disorder. They bear an unequal burden of this low healthcare quality, and that this is a multi-pronged problem that has to do with the condition. Healthcare providers, the healthcare system, and families and communities are all in their own ways contributing to these disparities. But we at OHSU and also other researchers around the country are working to try to reduce these disparities. Thanks. I guess we're doing questions at the end. Yep.